President Conference, Jane Backland, Sector Local Government Branch, moving Amendment 46.3 and first time Speaker.
Woo! Yay!
As a social worker of disabled children who will often have complex health needs, I know the need to integrate health and social care is something that is widely asserted by politicians. Andy Burnham, Labour's Shadow Secretary of State, has said that he wants to see the full integration of health and social care services and the creation of a single service and single budget. The current government talk a lot about service integration too, though in the context of savage cuts. Their Better Care Fund has been criticised for simply shunting money from the NHS to local government to fill funding gaps that they have created. The integration of health and social care is very much in fashion, and we can see the principle in that. It makes sense. Health and social care services are interrelated. For an elderly person who's been admitted to hospital following a fall, their return home is likely to be dependent on social care services being put in place. It is important that these services are integrated and can work together. But while health and care functions are clearly interrelated, we have two very different systems in terms of both provision and consumption. The gap between our health and care systems is a gaping chasm. So on one hand, you have social care services that are provided mainly by staff employed by small private companies. Central government cuts have led councils to tighten contracts, such that there is continual downward pressure on staff terms, conditions and training budgets. The way the provision of social care is organised in our society is an absolute disgrace, and it is only the hard work and dedication of low-paid staff and undervalued care workers that keep the system going. In contrast, healthcare remains overwhelmingly provided by NHS organisations. Jobs are evaluated and there is a greater emphasis on training and quality. What is terrifying for us all is the direction of travel in the NHS. With the government's top-down reorganisation, private sector organisations are carving out a role in healthcare and the whole system is creaking under the pressure of insufficient funding. Again, it is the dedication of staff that is keeping the service going. What we must guard against in social care model of low-wage, privatised provision being inflicted on the health service. It must go the other way, with the principle of direct public sector provision being exported into social care. And the experience of a service user is quite different in social care than in health. So in social care, those who use services have to pay. The means of the service user are assessed as well as their needs. In our NHS, of course, healthcare is free at the point of use. But again, the trend is worrying, with the government's health reforms opening up more scope for queue jumping and two-tier services, where extra or speedier care is available not on the basis of need, but on the basis of the ability to pay. We must again reassert the NHS principle of needs-based services, fight to retain it in health and export it into our social care services. The conference, integration of health and social care is not in itself objectionable, but we need to be worried about why it is being promoted now, in a context of underfunding of all public services and the erosion of some of the core principles of our NHS. We need to guard against the way the social care is provided and consumed being exported into health. Conference, I move.